When you first start Medicare, you have a major decision to make right off the bat, and it catches most people by surprise because they really haven't given much thought to Medicare until it's time to start Medicare. And this decision is going to determine which way your health care is going to work pretty much for the rest of your life. So you're going to need to choose whether you're going to stay with original Medicare, Part A and Part B, or whether you're going to choose to go into a Medicare Advantage plan. And it is a huge decision. They work completely differently. So it's really important that we understand that. And I'm going to go through that right now. I'm going to tell you why I would never choose Medicare Advantage plan. I would do anything that I could to stay with original Medicare and show you exactly the differences between the two. And I'm Keith Armbrecht, founder of Medicare on Video. I help people across the country make the right Medicare choices. I can absolutely help you as well. You're welcome to utilize all my information. I've got a tremendous amount of information on my website. I also have a book that you can download for free. There's no cost to any of it, so make sure you take advantage of everything that's there. Right now, we're going to talk about the difference between choosing original Medicare and choosing Medicare Advantage. I just wanted to jump in for a quick second and invite you to join my private Facebook group, Talking Medicare, where you can get answers to just about any questions on Medicare and interactions with others that are also in Medicare. There are no agents, no sales whatsoever. It's absolutely free. Just visit talkingmedicaregroup.com. It'll take you right there. You can sign up for free. Easy to do. Enjoy the video. And again, it's like night and day. So you want to make sure that you make the right choice. I'll tell you exactly how I feel about it and what I think anyone really should try to do as they go forward. So let's kind of understand the differences between the two. With original Medicare, you have Medicare Part A, Medicare Part B. There are some out-of-pocket expenses on original Medicare, and they can be big. So Part A, which is hospital, so Part A has a inpatient deductible of $1,600. Certainly wouldn't want to pay that if you're admitted into the hospital. And Part B, the out-of-hospital stuff, doctor stuff, pays 80-20. So it pays 80% from Medicare. You're responsible for 20%. Now that's not too bad, but the problem there is the 20% doesn't have a limit. So it doesn't have any stop to it. So if you had something catastrophic, that 20% could go quite high. So you absolutely want to cover those out-of-pocket expenses. And if you stay with original Medicare, you would do that with a Medicare supplement plan or a Medigap plan. So those plans cover those gaps in Medicare for the most part. So we understand that from an out-of-pocket expense with original Medicare. Your other choice is to go into a Medicare Advantage plan. So a Medicare Advantage plan takes you away from original Medicare and puts you with a private insurance company. It really ought to be called Medicare Managed Care, because that's exactly what it is. It puts you with a private insurance company, and there are different types. There's HMO type plan, and there's PPO type plans, and there's differences between those as well. And one of the big problems with Medicare Advantage is they are all completely different. So you don't necessarily get to choose or compare apples to apples because they function completely differently. So you want to make sure you understand exactly what you're getting into. And one of the biggest problems is most people don't understand, and they're sold into a specific plan that may not be the best for them. Most insurance agents out there generally are selling Medicare Advantage plans, and there are certainly some good agents that take the time to make sure that it's in your best interest and not in their best interest. But what you will find, especially with stuff that's on TV, call centers and things like that, where they are soliciting you, that they aren't doing it in your best interest. They're doing it in their best interest, and it can have a dramatic effect on your health care really for the rest of your life. Because once you get into a Medicare Advantage plan, you may be stuck in that plan for a very long period of time. So you want to make sure you understand what you're doing. So with a Medicare Advantage plan, again, it works like managed care. So it has a network of doctors and a network of hospitals. And if you're in a large metropolitan area, it may have a larger network of doctors and a larger network of hospitals, but a lot of times they're specific. So they are designed to contain cost for the most part. So they're most advantageous to the Advantage plan and kind of control the cost expense to that plan. So the choice can be limited from a doctor standpoint or from a hospital standpoint. With original Medicare, there are no networks. So you can go to any hospital, any doctor, anywhere in the country that accepts Medicare. You don't have to ask for permission. So you want to make absolutely sure in a Medicare Advantage plan that it has all the doctors you want to go to, has the hospitals that you want to go to. It may not have what you would consider the best hospital in your area, or certainly the most convenient hospital to you where you would like to go may not be in your network in Medicare Advantage. So choice is a big difference between original Medicare and Medicare Advantage. Again, on original Medicare, you can go anywhere you want, anywhere in the country. You can go to any doctor, any hospital that takes original Medicare. And that's certainly the majority of doctors and hospitals in the country. With Medicare Advantage, you're restricted to the network of doctors and hospitals that are generally in your local area. It can be very problematic if you're traveling, because if you run into a medical situation where you're traveling, you're going to be out of the network. You're going to be out of the service area. And while emergency services are covered, once the emergency service part of it is over, you're going to need to return to the service area to be able to have coverage under your Medicare Advantage plan. So it can be very problematic from a choice standpoint. That's certainly a main reason why I would stay with original Medicare. It's because I want to choose the doctor and the hospital that I want to go to. If I have a specific form of cancer that may be a little rare, I want to go to the specialist that knows how to treat that. I don't want to have to look through the directory to see what specialist I can choose from. I want to go where I want to go. And again, just gives you the freedom and the flexibility to do the things that you need to do with your healthcare. Another difference between the two would be what's called pre-authorization, which you may have run into previously, where when you go to the doctor or the specialist and they're figuring out what type of treatment plan you need, whether it's a hip replacement, a knee replacement, whether it's cardiology, whatever it may be, and they feel that you need something, and then they follow up with, but first we have to see if we can get it approved. We have to contact your insurance carrier to see if we can get it approved. And that is not something that I want in my future healthcare visits. And with original Medicare, there is no pre-authorization. If you're on A and B with a supplement, you go, your doctor says you need something. If you agree, that's it. As long as it's medically necessary, it's covered by Medicare. And if it's covered by Medicare, it's also covered by the supplement company. The Medicare supplement company plays no part in the decision of care. They don't choose to approve or deny anything. If Medicare covers it, the supplement has to cover it. It is a completely different story with Medicare Advantage. Medicare Advantage has the ability to either approve or deny whatever the doctor requests. So a doctor may suggest that you need a certain treatment, and the Medicare Advantage plan may go, well, no, we're not going to approve that. You need to try these 3 other things first before we will consider approving that treatment plan. And again, not what I would want with my healthcare. If my doctor thinks I need it and I agree, then I want to do it. And I don't want to have to ask for permission from an insurance company who is there to make profit on my health plan on whether or not they will pay for something. And I can tell you, it's even getting worse these days with AI, artificial intelligence, where a lot of the Advantage plans don't even have a human involved in making these decisions. It's strictly done through artificial intelligence now, where it goes in and then it's denied. And you have to, sometimes the doctor's office has to fight back and forth on whether or not they can get something approved. And again, I don't want that for myself. I don't want that for my doctor. I want my doctor to be happy as we're going along too. With original Medicare, again, it's a different story. There are no pre-authorizations to where they have to fight to get something approved. And another big reason why I would always choose to stay with original Medicare with a supplement plan, and I would never choose to go with Medicare Advantage. Another big difference is referrals, and you may have run into that in the past as well, where you need to go, if you're going to go to a specialist, first you need to go to a primary care physician, get a referral, and then go to the specialist. So you need to go ask for permission from a primary care on whether or not you can go to see a specialist. And what a lot of people don't realize is a lot of times those referrals make an impact on the income of a primary care. So they are not necessarily so easily going to refer to a specialist because it may impact their income, which is a crazy way to do healthcare, but that is part of some Medicare Advantage scenarios. So especially in an HMO environment, you want to be very careful of that and understanding of that if you need to go to see a cardiologist or cancer specialist or whatever it may be, first you have to go to a primary care, and sometimes they can only give you X amount of visits to that specialist. And then you need to come back to get additional referral visits to go to a specialist, which again, not something that I would want to have in my healthcare when I'm going to need it as I get older. Original Medicare doesn't have referrals. You don't need a referral to go to a specialist. If you need to go to that cardiologist or that cancer specialist, whatever it may be, you simply make an appointment. And again, you don't have to go through a network book and try and figure out who's accepting new patients, things like that. You simply call, make an appointment, and as long as they accept Medicare, which obviously the vast majority do, then they are covered under Original Medicare. So again, that's a major difference between Original Medicare and Medicare Advantage. Now, when we talk about the cost differences between the two, obviously cost always is going to play a part, and we want to be as value oriented as we can. So the way they work is Medicare Advantage is pretty much a pay as you go. So it probably has a lower cost up front from a monthly cost to Medicare Advantage. Some of them have zero premium, but I can also promise you, even with Medicare Advantage, the lower that initial cost is, the more restrictive it is going to be. So obviously some people are having financial issues. They can't have as much choice based on monthly cost. They have to go with a lower zero cost type Medicare Advantage plan. It's certainly understandable, but if you have the ability to choose, you want to put it on a whole type level process between comparing the two. So with Medicare Advantage, you're going to have a lower monthly cost going in, but it's going to be higher to utilize as you use it. So it's kind of a pay as you go. Medicare Advantage can have an out-of-pocket limit for the year as high as $8,000. So it can be a significantly high out-of-pocket expense when you use it, where Medicare Original, A and B, you have a Medicare supplement plan. And something to understand, Medicare Part B has a monthly premium. So no matter what, whether you're an Original Medicare, you're going to stay there, or you're going to go into a Medicare Advantage plan, you're still going to pay that Part B premium. So that Part B premium is there no matter which way you choose to go. So kind of take that off the table because you're going to pay it regardless of which way you go. Now, if you stay with Original Medicare and a supplement, Plan G, Plan N, maybe a GHD, high deductible, we figure all that out for you, make sure we find the best value. But what we try to do with most people, and I'm licensed in all 50 states, we can help anybody, anywhere, is find the right supplement that's close to $100 or less. And a lot of times it is less. Most of the time it is less. So we want to get that supplement plan to where it's close to $100 a month or less. And then with Original Medicare, with that supplement, when you use it, very little out-of-pocket expense. So you would have maximum out-of-pocket expense in the hundreds of dollars versus Medicare Advantage in the thousands of dollars. So significant difference when you use them. So if you had the same medical scenarios on each plan, it's likely going to be less expensive under Original Medicare with a supplement than it would with a Medicare Advantage plan. If you go through the year and you don't use any medical services whatsoever, it's likely going to be less on the Medicare Advantage plan. So understanding that, but we want to plan for when we do need it. That's where we're going to find that it comes to help in most cases. So with Original Medicare and a supplement plan, again, freedom. You can choose any doctor, any hospital, go anywhere in the country, do anything you want. As long as it's medically necessary, it's covered. Low out-of-pocket expense when you use it, so you don't have a big financial burden when you also have a medical burden. no pre-authorizations. You don't have to ask for permission under Original Medicare if your doctor and you agree that you need a certain type of treatment. As long as it's medically necessary, it's covered under Medicare. It's actually, it's almost too good, but it's fantastic to have when you need it. And then no referrals under Original Medicare with a supplement plan. You can go to a specialist without having to ask for permission. Last thing I would talk about is travel. If you foresee yourself traveling in retirement, which certainly most people do, it can be very problematic in a Medicare Advantage plan because you have that network localized of where you can go to doctors and hospitals in your local area. If you travel outside of your service area, it can be problematic. With Original Medicare, not so much. You can go to any doctor. If you want to go state to state, you want to go across the country to a doctor or a hospital, you can do that. As long as they accept Medicare, and certainly most do, then you don't have to worry about whether you're within network. So those are main reasons why, again, I would choose not to go into a Medicare Advantage plan. And obviously what I do is I help people get the right Medicare supplement plan. I could absolutely help people get into Medicare Advantage, but the fact that I wouldn't do it myself would make me much too uncomfortable to try and sell somebody else into Medicare Advantage. And that's kind of what you find with Medicare Advantage, is they're sold into it, either by a TV commercial or by some aggressive phone call that is selling a particular Medicare Advantage plan. They get in, they find out their doctors aren't there, the hospital they want to go to is not there. It just can create a very big problem for your healthcare going forward. So I would 100% recommend Original Medicare with a supplement plan. If you want to know what it costs, just visit my website, MedicareOnVideo.com, put in your basic information. We will email you a quote of the best Medicare supplement plan in your zip code, and that way you know right off the bat beforehand exactly what everything is going to cost. So we want to make it easy, affordable, and just set it up the right way in the beginning so we don't have any issues down the road. So I hope you found this helpful. Take a minute, download my book, Medicare Made Clear. I'll show you how to do that right now. Have a fantastic day. Thank you for taking the time to watch my video. I hope you found it very helpful. A couple of other things that you'll also find very helpful. Number one, download a copy of my free book, Medicare Made Clear. I spent a lot of time and a lot of effort putting this together, and it has everything that you need for Medicare now and in the future, down the road. I have videos in the book. I have all the links that you need for things that you'll want to do within Medicare. You can access it right in the book. Very easy to do. Just visit MedicareOnVideo.com/free book, and you can download it for free. You can save it on your computer. You can save it on your iPad. It's a great resource to have, again, for now and in the future. Another thing that you'll find helpful is down the road, when you come into Medicare, sometimes it makes sense to do a price check on your Medicare supplement plan. So I made it very easy to do that as well. Just visit MedicarePriceCheck.com, put in your basic information, and we'll email you a quote on your same plan that you have right now, a G or an N or an F, whatever it may be. And likely we'll be able to save $20 to $60 a month in premium, because a lot of times plans come out with better rates. So if we can get a better rate for the same plan that we currently have, just makes a lot of sense. And then obviously take advantage of all the information on my website at MedicareOnVideo.com. I have everything that you need right there for understanding IRMA, understanding employer work coverage, everything that you need, especially in the guides and forms section, you'll find right there. So we update everything every year, so everything should be up to date and current with the right deductibles and premiums and things like that. Hope you found all this helpful. Have a fantastic day. Wait, don't go anywhere. There's a couple more videos right here that you'll find very helpful with your Medicare journey. So take just a minute, watch the videos. You can also subscribe to my channel by clicking this button, and that way you'll have access to all my videos for everything that you need for Medicare. Hope you find it helpful. Have a fantastic day.